name is Kathy Wheat, and I am Program Director Professor for the Speech Language Pathology Assistant Program at Oklahoma City Community College. I'm here today to visit with you about utilizing support personnel to improve your practice. While I'll talk to you today and use terminology such as speech-language pathologist or speech-language pathology assistant, I would also like to offer that the strategies and skills presented in this training would also be incredibly useful for audiologists that work with audiology assistants. So it's one of my favorite topics, and I hope that your time is well spent today and that you learn much. My disclosures today: I do have a financial disclosure. I'm a Program Director Professor for the Speech Language Pathology Assistant Program at Oklahoma City Community College. I also work PRN as a speech language pathologist in one of the larger school districts in Oklahoma. I have non-financial disclosures. I chair the Oklahoma Speech Language Hearing Association Schools Issues Committee, and I am the State Educational Advocacy Leader for ASHA for the state of Oklahoma. I also do consulting with public schools in Oklahoma, and I am currently serving on the Oklahoma Advisory Task Force panel for IDEA. Workplace challenges for speech-language pathologists. While I'll be talking today and using terminology for speech-language pathologists and speech-language pathology assistants, I want you to know that the strategies and skill sets that we talk about today are also applicable to audiologists working with audiology assistants and may be used in either practice with either type support personnel. Workplace challenges for speech-language pathologists. Wow, we have many today. Large caseload numbers, myriad paperwork, lack of adequate time to plan for complex cases, needed additional time to focus on challenging cases, more demands from public school regarding evidence-based practice, trainings, evaluation and accountability measures. Very, very difficult environments to work within. I was at a large state association meeting this fall and asked SLPs that were school-based SLPs to raise their hand if their caseload numbers were over limit. 90% of the audience raised their hands. Never in my career have I known the job of a speech-language pathologist to be as incredibly stressful as it can be today. That said, there are options and strategies that we can use to better our practice and to begin working at the top of our license. SLPs working at the top of your license. ASHA's ad hoc committee report, titled Reframing the Professions of Speech-Language Pathology and Audiology, gave us valuable information about how to reframe the lens through which we look at our professions. Working at the top of your license means that you engage in only patient care activities that require a high level of expertise. What that also infers in that statement is that you delegate activities that are routine in practice in nature. So it means I, as a speech-language pathologist, understand that the maximum use of my time and abilities is on those higher level thinking and reasoning, diagnostic, therapeutic interventions that I do with clients. And I'm able to, with that understanding, delegate to other professionals those repetitive tasks such as drill and practice that might be accomplished through someone with adequate training and experience. SLPs spend a great deal of therapy time practicing those repetitive type skills. So, to recap information about workplace challenges for speech-language pathologists, while we know large caseloads, myriad paperwork, lack of adequate time to plan, complex cases, all of those challenges make practicing as an SLP difficult. And what we want to talk about today is what are strategies, how can I use support personnel to limit those challenges and keep focus on the main thing, and that main thing being client or student success. Part of working at the top of your license ensures that we are engaging as SLPs in skill sets that are at the higher end of our profession. Those skill sets that we have the appropriate adequate training, both academically and clinically, as practitioners to implement with patients. SLPs spend a great deal of therapy time practicing new skills or getting ready for therapy, and the amount of time we spend on that and our effort and energy, if we're placed in a different direction, would yield greater and higher client success. It also decreases the cost of providing those services. Sadly enough today, we are at a point where we do discuss cost, and cost for clients and cost for students, and that's becoming a major concern. With the utilization of support personnel, costs can be lessened and focus more directed toward skill sets, roles, and responsibilities for the appropriate professional. A picture's worth 1,000 words, and as I put this picture up, this picture reminds me of what most SLPs think about when they're first asked to partner with support personnel. This picture may make you laugh, might make you smile, and it might make you cry, and I totally understand all three of those reactions. SLPs have related to me that what they sometimes feel and understand is being asked to work with support personnel is just adding one more something to my plate. It's just increasing one more responsibility, adding to my load, and how in the world am I going to get that done when I can't see daylight with what I need to do right now? Those are all very valid concerns and valid issues. And what I want you to know today is implementing a lot of what we're talking about, you're going to be able to not feel as though you are the individual in this picture and that you are empowered with those strategies and know how to successfully implement support personnel. In this next clip, an SLP who began working with support personnel years ago is going to talk about her experiences and her reactions when first asked to work with support personnel in the profession of speech-language pathology.
When I was first asked to supervise an SLPA, I initially had very little apprehension about it. I had had prior experience of supervising SLPAs in another state. At that time, however, I did not fully realize how time-consuming supervision would be. Supervision is a commitment. However, it's one of the things I love about my job. I enjoy the collaboration and mentoring aspects of supervision. I learn from my SLPA, and my SLPA learns from me. Communication and mutual respect are critical for a great SLP-SLPA team. Both the SLP and the SLPA have to be willing to be vulnerable enough to let the other see their weaknesses, strengths, and mistakes. Supervision is a two-way street that works the best when both the SLP and the SLPA are fully invested in the journey. As the SLP and the SLPA, you have to be willing to let your guard down and be willing to work through the good, the bad, and the ugly. It'll likely be the most influential working relationship that they have at their jobs and possibly the most rewarding relationships that they will have.
Where do I begin? You are entertaining the option of working with support personnel, and that's incredible. And as that, your first question really truly is, where do I begin? Supervision training is incredibly important to beginning to understand how to work with support personnel and how to work at the top of your license. I fully support and recommend that you receive supervision training specifically for working with support personnel. There are ASHA focuses and initiatives right now on supervision training, and that's so incredibly important. It's important that you distinguish between supervision training for students, for clinical fellows, and for support personnel. And depending on the population of professional that you're working with, you attend and understand and learn to demonstrate tenets learned in successful supervision training experiences. General supervision. In the amount of time we have today, we can't talk about or will not be able to talk about all the tenets of the continuum of supervision. We've talked about how it's different for different individuals, whether you're supervising a student or a clinical fellow or a support personnel such as a speech-language pathology assistant. The continuum for supervision, the references you'll find in the documents with this training, important that you review those. What the most important thing for you to know is for the continuum of supervision for a clinical fellow, we're moving toward independence. We're wanting that clinical fellow to become independent and then to be fully independent in their practice. For support personnel, for speech-language pathology assistants, we're never working toward a continuum of independent practice. We're working toward a continuum of supervision and direction supervision and at times maybe management, and we'll talk about that in just a minute. But knowing that that individual is not working toward independent practice is a critically important concept for you to understand. That, along with attending the appropriate supervision training for the person and professional that you're going to work with. There are also ideas and concepts within general supervision training that are important to us, concepts such as understanding, and there are tenets in those constructs for both the speech-language pathologist and the speech-language pathology assistant. We won't be able to go through these in depth, but I want you to understand just a little bit and get a flavor of how that might play out for the professional SLP and the professional SLPA. In the area of understanding, you both would bring together your elements of understanding your roles in that client care, what your position is, what your mandate is, those strategies that you are responsible for. Also, in planning, there's specific planning for the SLP, there's specific planning for the speech-language pathology assistant. An SLP's planning would include assessment and goals and objectives for that client. Planning for the speech-language pathology assistant may include activities and ways that they're going to gather data collection, the mechanics of that therapy, very appropriate for that speech-language pathology assistant to be a part of that planning. The third tenet of that would be observation, and that's for data collection. And there are aspects of data collection for the speech-language pathologist and aspects of data collection not for the purpose of analysis for the speech-language pathology assistant, but for the purpose of knowing within that therapy segment where your client or student may be. The next element of that is analysis, and there's analysis that can be conducted by the speech-language pathologist and the speech-language pathology assistant. The speech-language pathologist is using the analysis phase to think about assessment and moving that client forward. The speech-language pathology assistant may be using that analysis phase to reflect back on their therapy skill set levels and the things that they could do better in the next session, that they might not have done well in the past session, or the ways in which they want to go to the next level. And again, we're just briefly touching on these. Finally, integrating. And there are aspects of integrating, conferencing, dialoguing, sharing that the SLPA and the SLP can share in those activities as they relate to the general aspects of supervision and that continuum and those aspects of general supervision. I love this picture. I want you to take just a minute and take a look at it. It's absolutely what supervision of support personnel is not. This picture, this graphic comes to us from the profession of nursing. And nurses have long had supervision training and understood those constructs and those tenets. And as we look to other disciplines, such as physical therapy, occupational therapy, nursing, we can find great support and great understanding and great knowledge from them that we can also use in our discipline. And this is absolutely what supervision is not. There are three important concepts when it comes to supervision. And I have found in my experience that SLPs, when they are confused or unknowing about these three types, struggle more than necessary when partnering with speech-language pathology assistants. Managing, directing, and supervision. Managing, and we all may manage other individuals in our work worlds, depending on if we work with administrative assistants or we work with other individuals within a business environment or within a school environment. Managing goes more toward managing that individual's workplace behaviors. So are they coming to work on time? Are they leaving on time? Are they behaving appropriately in the professional work world? Those aspects that typically go along with being the person that hires that individual. Now, you may have assumed or been given those roles and responsibilities. The important idea here is if I don't understand that managing is different than directing and supervising, then I get caught up in the managing of that person in the workforce versus directing and supervising. When I think about directing and when I think about supervising, directing means I'm planning for, I'm purposing, I'm controlling the outcome. I'm managing in a way different than the workplace behaviors, and I'm focusing more on the skills and abilities and the structure that that therapy session is going to have. And I'm directing the person providing the therapy, which would be the support personnel and their role. Supervision is also another very important tenet. While I might be directing, and that means I'm providing the concepts and the basis and the outline for what we're going to do with therapy and how the support personnel is going to do that. Supervision is when I'm actually supervising the ongoing process of that. So I'm actually in the moment, directly or indirectly supervising what that support personnel is doing with that client or with that student. So very important that I understand, and we could spend hours on this one topic, very important that I understand, am I managing their workplace behaviors, or am I directing what's happening with that client or with that student, or am I supervising that individual as they're doing it? When an SLP is very clear on those three constructs and is purposeful with what they're doing and when they're doing it, they're able to provide the appropriate management, direction, and supervision for that support personnel. We talked about supervising in that role, the overseeing. What I do want to add to this is keeping the main thing the main thing. What I find with speech-language pathologists often is they are so focused on the support personnel that the client and their needs, or what needs to be done with the client, actually comes in a secondary role. And so what I teach and what I train is keep the main thing the main thing. The main thing is what could the client not do yesterday that they can do today, and what do I want them to do tomorrow? And if I as an SLP say stay focused on the main thing, the client's success, then I'm able to appropriately work through those management and supervision and direction tasks, staying appropriately focused on the supervisee, on the speech-language pathology assistant, and keeping my main focus on the client and where I want them to be. The SLP is ultimately responsible. And what I so want you to gather from today is, while the SLP is responsible, doesn't mean the SLP does everything. It means that they do a crackerjack job of either managing, directing, or supervising, and they focus on client output, student output, and success for our patients and clients. What do you need to know? You need to know about guidelines and regulations for support personnel. ASHA has guidelines and scope of practice documents for SLPs and SLPAs. You'll find those in the reference section. We talked about the SLP being responsible. There are federal guidelines. IDEA allows for the utilization of support personnel and paraprofessionals. And that's not meaning a paraprofessional is in a public school environment. It's meaning a paraprofessional role. And you find that in IDEA, and that reference is in the back, in the documents as well. Also, ASHA provides an awesome state-by-state comparison. State regulations and licensing and certification requirements. Some have them, some don't, and they vary state by state. You'll want to be sure and know what your states are so that you can appropriately know what your expectations should be with the support personnel with whom you work. What makes a preferred partnership for SLPs and support personnel? From the discipline of physical therapy, the term preferred partnership comes, and we want preferred partnerships between SLPs and support personnel. In this next video clip, an SLP who's worked with support personnel for quite a while is going to talk to you about that preferred partnership.
Initially, when asked to supervise an SLPA, my first thought was yes. I enjoy the supervision of students, so I thought this would be just another opportunity for teaching. In addition, the use of SLPAs in Oklahoma is a relatively new concept. Therefore, I thought it would be a great opportunity to get in on the ground floor and try something new. As far as issues or concerns that I may have had, being that this is my first year to supervise an SLPA, I think it took me a while to wrap my mind around my responsibility as a supervisor, as well as the role and responsibility of the SLPA. I also had to readjust my expectations of an SLPA. Initially, my expectations of the SLPA were that of a CFY, because that is my past experience of supervision. However, when I was able to differentiate the knowledge base of a CFY versus an SLPA, it made the supervision piece easier. As far as what makes for a good SLP and SLPA team, I think it's just that, teamwork and communication. I have been fortunate enough to have a background in rehab and was able to observe the relationships of the PT and PTA and the OT and CODA teams. They do not work individually as the PT and the PTA. They work as a team with the focus on the patient or student. And I think that same focus should be had by the SLP and SLPA team. It's not about the titles, it's about the student.
What you heard Lisa talk about in that clip are communication styles, and communication styles are critically important. If I encouraged you to begin at any step in your journey toward working with support personnel, it would be exploring and understanding communication styles. And again, we could spend hours on this next topic, and I'll give you just the nuts and bolts. Important for you to know, am I working with an SLP or an SLPA who is a thinker or a feeler? It's critically important to know. Thinkers, their speech typically sounds like, I was thinking I might. What do you think about it? Do you think we could? What are your thoughts? If your speech sounds like that, if your language sounds like that, you're most often a thinker. If your language sounds like this, I was feeling about, I feel like I just feel like we ought to. How do you feel? What are your feelings about it? If you find yourself using that language in your speech, most often you're a feeler. It's very important to know thinkers are task-oriented. They're typically efficient in their communication style. They want just the nuts and bolts. Give me the gist. Feelers are relationship-oriented. Very important that there's a relationship, and the language of relationship plays in that collaboration. If you're a thinking SLP and you have a feeling SLPA, then it might be very natural for that SLPA to feel like that you are too direct or too bossy or not cognizant of their feelings. And in the reverse, the same way. SLP might feel as though that support personnel was bossy or demanding or directive in a way that would not be appropriate. So very important to understand those two differences. I've also included today in the training and discussion a communication style inventory. What's great about this is you as an SLP can take this, have your SLPA take this, sit down, have a discussion about who you are and what's your style. Understand the tenets of that style. Just to give you a flavor for this, there are controller directors, promoter socializers, supporter relators, and analyzer thinkers. And there are lots of communication style inventories. I like this one because it utilizes aspects of what we do on a daily basis. WH questions are a piece of this inventory. Some individuals answer the what question and need to know, what do you want me to do? Some need to know who else is doing it, who says it's important. Some need to know why, others don't. And some need to know, how do I do this? Once you understand who you are and what your style is, and that of the support personnel, you can begin speaking the same language in a way that yields client success. There are additional communication considerations, cultural diversity, cultural and linguistic diversity, important for you to read up, know about those differences, know how to respect and honor cultural differences, and then generational communication differences. And again, we could spend a lot of time on this next slide. I'm just going to give you one example, though, as a takeaway to give you just a taste to learn more. There are communication styles inherent to each generation. I'm a boomer. What speaks to me and the language I use is very different than that of a millennial. And what I have found with teams of SLPs and SLPAs, if you have a boomer speech language pathologist, their language may sound like, if I were you, I would. My suggestion is that I would have done this yesterday. Why don't you? When a boomer says any of those statements, what they're actually saying to you is, you should have, this is what they would have done, and this is what you need to do. So while they're going about it in a very indirect way, they're telling you what you need to do. A millennial, however, is very different. That's not what they hear. When they hear a boomer say, if I were you, I would, they think, that's great. Thank you for telling me about yourself, and I appreciate that insight into you. Actually, for millennials, what they prefer is, tell me what you want me to do. Give me the standard, tell me what your expectation is, and when you frame it in that way, I can understand and know what to do. Just a flavoring of those generational differences and how they play in our communication styles and strategies. There may be a boomer SLP and a millennial SLPA, and conversely, there could be a millennial SLP and a boomer SLPA. So it's critically important that we understand and learn about those differences. Practice considerations for SLPs and support personnel. Academic and clinic training of the support personnel. Programs differ. Some programs offer academic training. Other programs offer academic and clinical experience fieldwork training. Know what training your support personnel has experienced and what coursework they may have experienced. Some programs offer coursework in autism or augmentative alternative communication. Know what their training is, and that guides you into directly and appropriately placing them with students or clients for therapy. Know regulations and guiding practices in licensing and certification, and then know appropriate roles and responsibilities and expectations for those. There are certain strategies for successful supervision of support personnel. Attend training, we talked about that. Know and understand ASHA guidelines and scope of practice. Know your state regulations, practice successful communication skills. Encourage your support personnel to work fully within their roles and responsibilities. Know when to manage, direct, and supervise. Stay focused on client progress and appropriate utilization of support personnel. And plan and attend professional development opportunities together. That, coupled with knowing how to work at the top of your license and how to delegate appropriately, makes you in a perfect position to be successful with working with and partnering with support personnel. There may be on-the-job training skill sets for support personnel. I hear back from SLPs all the time that talk about, well, when they came to me, I thought they would know more, or they had trouble with this skill set. Again, know whether or not the support personnel that you're partnering with had clinical experience training. That's going to make a difference on those initial months of your partnership. Some of the areas that I have over time known that SLPs have difficulty with support personnel and may need some training initially for a while at the beginning of that partnership. How to take data, ear training, explaining placement, teaching vocabulary or grammar, choosing activities for sessions, and completing paperwork both district and state. Just know that after the initial time working with and as you partner, those areas of struggle diminish and you become a synonymous unit working together and for the good of that client or student. Ethics matter, work appropriately. Those areas and struggles typically are an SLPA working outside their scope of practice and doing things they aren't licensed or certified to do, and producing or presenting credentials that they do not have. So encourage support personnel to practice ethically. SLPs need to provide appropriate supervision, both direct and indirect. Their advantages working with support personnel allows you time to work at the top of your license, help with paperwork, help with planning. You can do more with more and for more client and patient success. We've spent time today talking about many concepts involved with supervising support personnel. And while many of them need further development, I thought about, if I'm you today, what do I need to know? What's a takeaway for today? How can you leave after viewing this segment and start implementing and utilizing support personnel? With that in mind, what's important is to focus first on reframing the profession for us. And that reframing goes back to that ad hoc committee and their findings about working at the top of your license and understanding and knowing and giving yourself permission to delegate. Explore utilization of support personnel. Understand and implement the differences among supervision type. Don't do what was done unto you in graduate school. That's not appropriate when you're supervising support personnel. Implement a model of supervision specifically for them. Understand and demonstrate communication styles and strategies for success, both on your part and the part of your support personnel. Prioritize and make a goal for yourself to have a preferred partnership with support personnel. Understand and know regulations and licensing and certification guidelines. Implement communication styles and strategies that are appropriate. Practice ethical utilization of support personnel. It's very important as we grow professionally as speech-language pathologists in this way with the utilization of support personnel that we hold highest ethical standards and we each work within our roles and responsibilities. Finally, work at the top of your license. Work with pride in knowing that as you keep the main thing, which is client success and student performance, that you are doing the profession proud and that you are utilizing support personnel in the best ways possible. As we've talked today about supervising support personnel, our discussion highlights one of ASHA's strategic objectives. Objective number 4 for ASHA reads, enhance service delivery across the continuum of care to increase value and access to services. The outcome is enhanced service delivery across the continuum of care to increase value and access to services. More information on ASHA's strategic objectives can be found on ASHA's webpage. Thank you for spending time with me today. I appreciate your willingness to work and to partner with support personnel. I wish you the best and know that as you journey through this new period of professional growth, your patients and clients will experience nothing but success. Thank you.